In 2018, a Durban man visited a private hospital with severe leg pain but was misdiagnosed with a muscle strain and sent home with painkillers. His condition worsened, and after several visits, doctors discovered a severe vascular issue, by which time his leg had to be amputated. He sued the hospital and physician for failing to properly diagnose and treat him. The court ruled in his favor, awarding compensation for medical expenses, pain and suffering, and loss of future earnings. This case highlights the critical need for accurate and timely diagnosis to prevent unnecessary harm. Whenever you hear the phrase medical malpractice, the next thing you're likely to think is, who did what and how much are they going to get sued for? You're listening to episode 2 of the second season of Insuring Trust with Leppard, a podcast where we unpack the stories behind the Leppard underwriting team, who make it their mission to protect your reputation. If you are a medical or healthcare professional, this episode is especially for you. We're talking about medical malpractice, but no need to listen with your head behind your hands. We're going to discuss potential strategies for healthcare professionals to manage risks, explore various insurance solutions, and highlight evidence-based skills that healthcare professionals can adopt to reduce litigation. Joining the conversation in this episode are Janine Davis, the head of medical malpractice at Leppard. Boasting nearly 2 decades of experience in the insurance industry, Janine's extensive career includes the role of client relationship manager, specializing in PI and medical malpractice, and senior internal broker, respectively, at 2 multinational insurance companies. Deniro Pillay, director from Norton Rose Fulbright Attorneys. Deniro heads the NRF medical law team, which comprises of 28 lawyers based at the firm's Sandton, Durban, and Cape Town offices. This specialist team, which is one of the largest in South Africa, primarily focuses on the defense of medical malpractice claims against private hospital groups, 2 provincial departments of health, and medical practitioners. The team also provides regulatory and insurance advice in the healthcare sector. And our third guest is Beverly Bolton, our medical consultant and communications specialist. Beverly is a founding director of a not-for-profit organization offering pain management and therapeutic relationship skills training to healthcare professionals. Beverly serves on the advisory committee of the International Association for Communication in Healthcare. Welcome, everyone.
Oh, thank
Hi,
you.
thank you.
Lovely to be here.
Deniro, we're going to start with you. So in light of this particular conversation, I've been doing some reading and the numbers are quite startling. Can you please share your thoughts on this?
So one of the biggest threats facing the healthcare sector in South Africa is medical malpractice claims. The public healthcare sector currently has claims against the provincial departments of health that exceed a contingent liability of 100 billion rand. And, that's been reported by the press as well as disclosed by the various ministers, both provincially and nationally. Now, the private healthcare sector has also experienced a surge in medical malpractice claims. However, in my experience, whilst there's been an increase in claims, there has not been an increase in valid claims. Now, the increase in claims, in my experience, can be attributed to several factors, which includes patients becoming aware of their rights.
Rightly so.
Dr. Google and the available information out on various platforms. So becoming aware of complications arising from different procedures. I mean, today you can virtually on YouTube watch any surgical procedure being performed live. And that's empowering, and it's a good thing. We see that patients becoming aware that medical practitioners and healthcare groups have insurance cover.
Yeah.
And then lastly, access to lawyers who specialize in medical malpractice claims on behalf of patients.
You mentioned media, and a lot of us, or many of us, are guilty of consuming American content. And so the things that come to mind, you think like botched, right? And so with that landscape, you're thinking of a particular kind of medical malpractice claims. But in our context, I'm sure that differs, right? So what types of claims are most prevalent in South Africa?
Look, we haven't gotten to the American stage as yet, but it seems we are heading there quite quickly. One of the major claims areas arises from post-op complications, either due to the actual procedure itself or the post-op management of patients. Now, it's important to note that because there was a complication, this doesn't mean that there's somebody to blame.
Yes.
And, the courts have recognized this. And in fact, the Supreme Court of Appeal in a 2013 judgment stated that the human body and its reaction to surgical intervention is far too complex for it to be said that because there was a complication, the surgeon must have been negligent in some way or form. Another area we see quite a bit is drip infiltrations, IV drip infiltrations. So there's been a lot of those types of claims. And we've seen a reduction, though, in types of wrong surgical procedures being performed. For example, and this has happened, going in for a knee op to your left leg, but coming up with a knee op to your right leg.
That happens.
The mixture of patient names, which causes problems.
Yes.
So I think with the claims history and risk mitigation steps being taken both by practitioners and hospital groups, we're actually seeing a downward trend on valid claims in the private healthcare sector.
Okay. And so we were talking about private in that instance, but it's also been alarming seeing statistics in other areas, particularly where it comes to incidences of cerebral palsy. I mean, the global average is 2 per every 1,000 births, but in South Africa, it's 10 per every 1,000 births. I mean, for me, it's like, that's a red flag. That's a national pandemic. Like, what are we doing?
Yes, the unfortunate situation is cerebral palsy claims is a major portion of the claims in the public healthcare sector. In fact, if you look at that contingent liability that I spoke about, a large portion of that is childbirth-related cerebral palsy claims. The reality is, in the private sector, cerebral palsy claims have, over the last 10 years, reduced dramatically, and they now become exceptional claims rather than the norm. So it's something that's being tracked by the government, the Department of Health. Steps are being taken to reduce these claims, but it is that drives the stats in South Africa. It's rather a public sector issue than a private sector situation.
So I also saw there was a ruling. It was speaking to how they were pulling back from doing lump sum deposits in terms of like when they were paying out claimants, and they were choosing, okay, we're going to do a in-kind kind of thing. So we're going to pay for your medical bills. We're not going to give you money up front anymore.
Yes, so this particular case or cases is what is called the public healthcare defense or public healthcare remedy. One of the groundbreaking cases, in fact, before the Supreme Court of Appeal in the next month. Essentially, what the department is trying to achieve is, instead of paying out lump sum money to claimants, they would tender services and equipment in lieu of the money, alternatively stagnate the payment.
Okay.
And this has become more prevalent with child CP claims. The reason for this is, what happens is, when the claims are currently settled, they get paid out a lump sum amount for the duration of the child's life. So you would pay, say, 15 million for a 30-year life expectancy. So what happens to that money after the child dies is that money is inherited by the parents generally. Now, that money could be used by the department to improve the healthcare facilities and the provision of services, which ultimately would then have the effect of limiting the claims. So by doing this, the intention is to pay or provide the services and equipment instead of giving the lump sum in circumstances where the lump sum is not being used for the purposes that it was awarded. And a quick example on the equipment side, you would have, for example, in a CP child claim, that one of the claims would be a wheelchair for the duration of the child's life. Now, the claimant would calculate that based on the market price for a reasonable wheelchair in the private sector.
Yeah.
So let's say that's 100 Rand. Now, we know with government departments like the Department of Health, you have a tender specification list where you would have wheelchairs as that would be provided to patients who are not part of medical malpractice claims. They would get those wheelchairs at 50% the value that you would get in the private sector. And therefore, they're saying, instead of paying you 100 Rand for the wheelchair, we'd rather give you a wheelchair and save 50%.
Shifting sands. So to your knowledge then, what's the highest paid medical malpractice claim to date in South Africa?
So currently, on averages, it is childbirth, cerebral palsy claims, because remember, again, you're dealing with life expectancies. So those claims sort of range from anything between 10 to 20 million. There have been claims on adult brain damage cases that have gone up to 30, 40 million, but that's based on the issue of future loss of earnings. So if you have a high net worth individual who has a high powered job with good earnings and following a particular compromise, and that person can't do their job anymore. There was a case, for example, where that in fact happened. That's what drives those particular numbers. So it's difficult to put a spot, but in South Africa, the major concern is the cerebral palsy childbirth related cases insofar as value.
So there's a universal adage that goes, prevention is better than cure, and we get that from the medical world. Deniro, this is a question to you, but Janine and Beverly, if you feel you can add some input to this. What are some simple risk management measures that healthcare establishments and practitioners can implement upfront to lessen the likelihood of a claim against them?
In the private sector, the patient is the doctor's patient. The private facilities provide the facility and they provide the support staff, being the nursing staff. I think important is doctors must realize that they can't manage a patient telephonically. They've got to physically assess the patient, make sure that they do that regularly, and that will avoid broken telephone or incorrect information being given to the doctor and orders being made on that incorrect information. Another big issue is informed consent. It's important that you discuss with your patients the risk of particular treatment or procedures so that they can make an informed decision. Not post facto, when the complication arises, you say, well, that's a known complication. Because if the risk would change the decision of the patient, they should be made aware of that. Another issue in the private sector that we see is doctors allowing nurses to do things outside their scope of practice. That may be titrating scheduled medication, which is not allowed. Again, I come back to the position. The patient is the doctor's patient, and it's your responsibility. That is why you're being paid a fee. So you've got to make the effort.
I was talking to a neurologist friend of mine, and those 2 points in particular that you mentioned, he spoke about enough trained nurses and the need to adhere to guidelines, and that standard practice is they need to record everything that they find, and the importance of doing the basics well. Beverly, do you have anything to add to that?
In order to reduce claims, a lot of people are focusing on the procedural aspects of it. But actually, you can protect against a lot of stuff if you also look at the interrelationship between the doctor and the patient, or the healthcare practitioner and the patient. And I think that's often neglected. People treated with compassion are often less in the mood to sue unless there has been something really important, like a birth injury. And I think that's neglected. The human element is so often, you mentioned informed consent. I mean, informed consent is a communication issue, particularly in our country with our wide range of diversity and languages. And unless people are actually trained in how to have that conversation with the patient who's in a vulnerable position, who has a lack of power, it is a complicated procedure. Frequently, doctors do actually talk about informed consent, but the patient may not be in the space to listen or understand, and actually don't remember at all.
Sure.
So they're big issues, and in my field, we're picking up a lot of stuff where the hospitals and groups are getting better and better at actually nailing down what you have to do procedurally to reduce claims, but they're neglecting the human element.
Janine?
Yes, all of the points raised by Deniro and Beverly is completely valid. One other aspect is I feel like doctors need to start speaking to each other. So peer reviews, that often should happen, especially in very busy, high volume, high patient scenarios, or when there's multiple emergencies. You need to be able to get on the phone and speak to a specialist if they need to. The second things I think to brokers is just so that they need to understand the full extent of the business, because healthcare today is no longer the traditional healthcare. They do quite a bit of work in terms of alternative revenue streams. So for the broker to understand what they fully do and then disclose it to insurers to see whether they're able to cover that portion of the business is really critical.
Sure.
Yeah, Beverly raised a very important thing, the human aspect. Yeah. And, coupled with informed consent, to me, something that's very important is bedside manner. And, I do a lot of HPCSA complaint defense work. A lot of it could be avoided if there was proper communication and understanding that you're dealing with a human being on the other side that's scared. Because for a doctor, you're dealing with patients every day. It's regular for you. It's the norm. But for someone like me to go in for my first surgery under general anesthetic, it's a big thing.
Yes.
And I'll give you an example. I acted for this gynecologist obstetrician once who was dealing with this pregnant lady. And he was getting concerned about the size she was putting on. So he said, "You're getting fat, you need to exercise." And she lodged a complaint. Now, we were able to defend it because clinically speaking, he was actually right.
Facts.
Because by becoming, too large, you could compromise the baby and yourself.
Yes.
But it was the manner in which he communicated it. So bedside manner and communication, understanding that you're dealing with a human being would resolve a lot of complaints in my experience.
Oof.
I think we've got to remember emotion and all those things have been regarded as touchy-feely and soft skills. But in fact, your motivation to behave in a certain way is driven by emotion. You do something because you want to do it. That's an emotion, or not want to do it. And I think that's neglected in training. And I think the bedside manner, therapeutic relationship, whatever you want to call it, rests on a bedrock of communication skills, which is neglected. So it's an area that needs to be looked at.
So Beverly and I discussed this a while ago, and we were mentioning that, often in their last year at medical school, they do practice on the science part of it.
Yes.
Where I think there has to be an element of communication, how to communicate, effective communication with patients. And I think that needs to come from an institutional level before they start practicing. So that's a very good point mentioned by Beverly. The other thing I just wanted to mention is that, we have a ongoing matter now where the doctor there was a HPCSA complaint against him, and he didn't want to answer our calls. Doctors need to understand that the insurer is there for them.
Yes.
And that we're obviously wanting to help them, and so, there's anxiety that's involved. And even from a doctor's point of view, oh gosh, did I do something wrong? What did I do? And so the ducking and diving starts happening. And so they need to understand from an insurer point of view, when we allocate an attorney, they're representing not only us, but they're representing the client, which is the insured.
You mentioned something earlier where doctors having a variety of streams of income. In terms of, in our current context now, where you have doctors on social media, for instance.
Yes.
What kind of complexity does that bring to covering doctors now? Because I could imagine, I saw Dr. So-and-so say something on Instagram and I did it, and look at my face now. What kind of complexity does that add to ensuring and working with doctors?
So from the get-go, they need to let us know what they do in its entirety. Issues like telehealth and virtual consultations, that needs to be spoken to upfront, because we've got to actually underwrite it as an underwriting consideration. But also the reality is we've got a policy wording that deals with exceptions, conditions. And some of these conditions in our policy wording deals with compliance. So if they are compliant in accordance with the regulatory bodies, in accordance with all the laws that govern their business, there's no problems there. But when you start infringing on it and you don't let us know, that's a conversation that we can have with them. And for them not to shy away from it, tell us what you do so that we can then best advise you going forward, sooner rather than later, dealing with it at claim stage.
One of my doctor friends, sometimes you got to claim these things, like my doctor friend. And he was talking about how, especially having the thing of the potential of being sued or being taken to court, there's an element of defensive medicine that comes in.
100%.
You're just, obviously you want to work on your bedside manner, but you end up just being rigid and say, like, I don't want to get sued, so I'm going to do, I don't want to say the bare minimum, but when he said defensive medicine, I was like, that didn't sound good. Even from someone who's never touched a scalpel in their entire life. And so when I think of what doctors have to deal with or medical practitioners have to deal with, I was reading somewhere about there's even now like knock-on effects of practitioners living under the scepter of being criminally charged or sued. And there's apparently even a condition called medical malpractice stress syndrome. It's like PTSD that went to university or something like that. Janine, how do you mitigate the stress and inherent risk of this industry? And what are the benefits of insuring with Leppard for healthcare professionals or entities?
That's a brilliant question. So Leppard offers numerous benefits for healthcare professionals and entities seeking to protect themselves from malpractice claims. So we're in the business of paying claims. This is what we're here to do. Our covers are quite wide. We cover a range of scenarios, including breaches of duty of care, negligent acts, unintentional breaches of confidentiality, defamation, accidental loss, or theft of data, as well as automatically we include public and products liability. We are a full service specialist liability provider offering tailored solutions to meet the unique needs of our healthcare professionals. We prioritize clear communication by using plain language wordings rather than our own industry jargon, ensuring that our clients fully understand their coverage. Our core automatic covers are offered at full main limits of indemnity without sublimits at no additional cost to the insured. Some of these examples are unintentional breaches of confidentiality, defamation, accidental loss of data, and theft of data. The market sublimits this, where we give full main limits for this cover. We are forward-thinking and solutions-driven, so we help grow our broker's business with innovative solutions for complex insurance needs. We are committed to improving our technical knowledge as well as our technology. We are coming on board a wonderful system so that we can be out there with the brokers and the clients doing the things that we love doing, instead of behind a computer always, crunching the numbers and the data.
Helping them understand who they're covering.
Exactly. And lastly, our unparalleled claims philosophy is that we are unmatched in the market. We ensure that there is fair handling of all claims.
Okay. So Janine, on ensuring trust with Leppard, we enjoy a good story. And as the kids like to say, spilling the tea, right? So can you share an instance where an insured had to activate their cover in a case of medical malpractice?
Mzama, thank you. So again, there's a lot of examples, but one springs to mind. A pharmacist misread a document prescription and dispensed the wrong medication to a patient. Now, this happens too often, and I mean, anybody could fall into a trap of this type of situation. Resulting in severe allergy reactions and had to be hospitalized. The patient sued the pharmacist for negligence. The pharmacist, insured with Leppard, activated their malpractice policy, which provided them legal representation and covered and settled costs, allowing the pharmacist to resolve the claim and maintain their practice. So in other words, they didn't have to go out of business because of the claim.
Sure. And I love that they were able to continue and they were with their reputation intact, which is key.
It's critical. Yeah. And remember that the more your reputation as the insured, the better for the insured, the broker, and for ourselves.
So at the top of the show, we promised evidence-based skills to share with anyone listening. Beverly, as a medical consultant and expert communication specialist, what strategies can be adopted to reduce the incidence of medical malpractice litigation?
I just want to say that no one is completely expert in communication skills.
I'll be the judge of that.
You're going to be humiliated at one time or another in your life, as I found to my cost. I think it's a really important area, and I'm really glad Leppard has invited me here, because we so often look at, as I mentioned before, the technical stuff, the legal stuff, but even Deniro is saying it's about hurt feelings, it's about people. And it becomes critically important to acknowledge that, and then to look at it as, say, you need training in the area, not just knowing it. Knowing it isn't enough. It's a skill. It needs to be trained. So, I mean, that idea is acknowledged in the whole definition of medical competence. Medical competence is seen, obviously, as knowledge and technical skills, but that it's also seen as the practitioner's attitudes and values. And attitudes and values are actually demonstrated through your behavior. And that behavior is inevitably something about your relationship skills and your communication skills. So what's really interesting, and I'm not sure whether you know this, but it's for the US, but actually in most private healthcare systems, people have analyzed some of the malpractice litigation claims. And they found that it's up to 60 to 70% of communication issues are involved in those claims. Deficiencies in communication, those patient complaints relate to a whole wide range of areas. They talk about the doctor's lack of concern, their attitude, their lack of empathy, and so many issues around giving information. You know, she gave me no information, he gave me too much information. I didn't understand what the hell they were talking about with the information. So we need to contextualize it for South Africa and ask, is it different in South Africa? And I don't think it is at all, in my experience. There's not as much data available in this country as there is overseas, but there is some. And a recent study in South Africa found very low levels of satisfaction with care. Patients felt their health needs had been overlooked, and they reported feelings of being stigmatized and interrupted and ignored. It's interesting. I recently was asked to get involved in training emergency room specialists in a group because they were experiencing, in private care, they were experiencing huge numbers of complaints from their patients. And when they looked, why they called me in, is they started analyzing what their patients were complaining about. And I pulled out some of the complaints were, the doctor lacked compassion, treatment was cold and impersonal, the consultant was dismissive of my feelings, I didn't appreciate the way I was spoken to. So you can see, and this is the conclusion that the head of the department made, was that the complaints were not really about the standard of medical care. They were about the relationship that failed or was never established, in fact. And I think what's interesting for me is that you can predict future claims on the basis of how well a healthcare practitioner actually communicates. One study looked at the lowest scores in a doctor-patient communication in a national licensing exam and found that the lowest scores predicted future complaints to regulatory authorities of those people who scored lowly.
Those stats are doing push-ups. I mean, like, to be able to correlate that.
Exactly.
Yeah.
And one of my favorite studies, and it never fails to amaze me, is that they took surgeons giving their spiel to patients. They controlled for content, so they weren't counting what was said. They took just 10-second clips of the surgeon's tone of voice.
Oh, wow.
And then they asked raters to listen to those 10-second clips and to rate them on a scale of how much concern the doctor was showing and how much control or dominance the doctor was showing. And it was absolutely fascinating that those who had low concern, high dominance, and they tracked them over time, those were the ones who predicted with their malpractice claims. So, I mean, that's really interesting. And because of evidence like this, many countries are now offering, med-mal insurers are offering a discount on their insurance premiums if the healthcare practitioner has attended healthcare communication skills training. As I mentioned before, informed consent is critical. You cannot do it in today's world without your patient giving permission to do stuff. But equally, I think most of medicine now, as we shift into the non-communicable diseases, you want to engage your patient in their own healthcare. And for that, you need particular skills in shared decision-making. So it's all very well acknowledging that, but can communication skills training improve it? Well, actually, there's a compelling body of research that it really does help in lots of different areas. And it doesn't have to be time-consuming. I mean, we're under pressure of time in healthcare facilities. We're being squeezed with business ethics. We have less and less time to actually spend face-to-face. But the research shows that there's a trend that it may even decrease time that you spend with a patient.
True.
And that's because if you listen carefully,
you get to the nuts and bolts.
Yeah, and your patient is able to raise things and doesn't have to keep bringing it up over and over again. In fact, I only have one tattoo on my body, and that's this one. And it says
Nice
to
one.
listen. To listen with your eyes and your ears and your full presence and an open heart. And I think that we forget to listen. We don't hear what people are telling us. So there's interesting research as well that it can be as much as perceived time. So they did a thing with anaesthetists who were given a 5-minute spiel that they had to deliver to a patient. The only thing that changed in the two studies, in the one group, the anaesthetist stood next to the patient's bed. In the other, they sat. They would then ask the patients afterwards, how long was your anaesthetist with you? The one said less than 5 minutes, the other said more than 15. So you get that perception of time shifting depending on how the doctor behaved. Even in emergency room settings, I had to read up a bit about that when I was training the physicians. And the thing is that if you can read your patient's verbal and non-verbal skills and what they cues and what they're saying, allows you to tailor your message, because not all of us have the same needs. Some people need reassurance in a emergency room setting, and they need their anxiety tackled. Others need information. Others need their privacy to be respected.
Yeah.
But knowing who the person is in front of you means that you can tailor your message. So my last few things is what exactly is good communication? Everybody gets that it's a good thing, but defining and measuring what constitutes it is a remarkably complex and underrated skill. And you mentioned we need to bring it in at an institutional level, and it's in. The Health Professions Council has put in that good communication is one of the 7 core competencies for doctors, and because it's in that, it has to be trained at an undergraduate level. The thing is that communication is a skill. It's a skill like playing a guitar or any other skill, and it needs to be trained as a skill. And most universities are finding huge difficulty getting funding to put it in and getting teachers for it, and there's no time in the curriculum, so that they lack the resources to train adequately. In order to do good communication skills training, you should be working in small groups, allowing people to practice, giving skilled feedback, giving them a rerun, so that you get better at it over time. And just another point, you mentioned that this is going to benefit the claims, it will benefit patients, but actually it benefits healthcare professionals themselves. And I think, Janine, if you can point out to your clients that actually that burnout, there's an epidemic of burnout in medicine, and that causes people to depersonalize their patients and see them as objects and do defensive medicine. And but most of us in the caring professions actually went into caring because we wanted to make the world a better place.
Because you're firefighters.
Exactly. And so it causes us moral harm, actually, when we treat people like lumps of meat or a knee or a foot or a shoulder or whatever it is. So if we can get compassion built into training, which sounds like a weird thing, but apparently you need less than 60 seconds of compassion to reduce anxiety that lasts for 6 months. So you don't have to do a lot of it, but we need to do some of it.
Upfront work.
And we need to understand that our medical systems need this. The Institutes of Medicine did a landmark study report some time ago. They were saying there's not a quality gap between what we want to produce in medicine and what is actually being produced. It's a chasm. There is a big gap between what we're looking for. So, hats off to you, Leppard. I wish you all the best with your clients, and I hope that we can, all of us in this room, make a small change to move the system forward into one that is more compassionate and humane.
Thank you.
Bev, thank you so much for adding that human element, because that's really so key. Deniro and Beverly, shortly as we land this conversation, what parting thoughts do you want to leave medical professionals who are listening from a medical, litigious, and communication standpoint?
So from my side, I get the chance. We've talked about patients being humans. Doctors are humans too.
Yes.
And it's what Beverly said. Generally, they get into this profession because they want to help people.
Yeah.
No one gets in to cause a medical malpractice claim. But what is important is that ensure in today's litigious environment that you are appropriately covered for professional indemnity, that you have appropriate cover values, that you understand your policy and your policy terms, that you have the conversation with your broker and insurer about disclosures. For example, if you are locuming for colleagues, that you disclose what type of locuming you are doing. I had a case where a doctor was locuming and it ended up being a childbirth cerebral palsy case, a 20 million rand claim, and his cover was rejected because he didn't disclose that he was doing deliveries in the private sector. So, unless you Elon Musk's cousin, a 20 million rand claim for a professional can destroy you.
Devastating.
And lastly, I think just to reiterate what Beverly said, doctors, you are human. If you are heading to a burnout, take a break, because like all professionals, you've got to be on top of your game when you are dealing with humans, patients. And if you're not mentally there, you've got to be, you've got to know yourself and take that break.
I think pretty much everybody said what needs to be said, that the humanity part is important. Just remind yourself that emotion drives behavior. So if patients are cross or feeling demeaned, they are more likely to take the case as far as they can. And I think just to remember that small things make a difference. There's a quote that I like a lot. It says, one doesn't have to operate with great malice to do great harm. The absence of empathy and understanding are sufficient. And I think that's something that we can all take home as parents, partners, people, healthcare professionals.
Yeah, so I'd just like to add that, this question often comes up from brokers. What limits are adequate? There's no one string fits every band or person or entity or individual. So one needs to look at contracts, the contracts that they enter into. So if they practice with a hospital, they've got to look and see what does the hospital require them to have as a limit. They've got to look at industries, different sectors. So a physiotherapist versus a GP family practice versus a GP practice in an ER or in the hospital itself. So contractual, that's what they need to look at. Industries. And yes, because legal costs and defense borns out of the limit of indemnity, it can quickly erode that limit of indemnity, because we all know how expensive medical malpractice claim can get and escalate to, and also the length at which these cases can actually drag on to. So these are discussions that brokers must have with their clients, just to understand, contractually, what are they supposed to have as a limit of indemnity.
One of my favorite sayings over the last few years is good news is always on time. And hopefully what we've been discussing in this episode is good news for someone in the field. And just like that, it's the end of the episode. Make sure to listen to previous and upcoming episodes of Insuring Trust with Leppard on Spotify, Apple Podcasts, and YouTube. Don't forget to follow Leppard on X, Facebook, and LinkedIn at Leppard and Associates. Join us next time on Insuring Trust with Leppard.